We have 18 different graduate programs, many of them in general practice residencies, advanced education programs in general dentistry, but then a myriad of different specialty programs: oral maxillofacial surgery, endodontics, prosthodontics, periodontics, dental public health. And we have world-renowned faculty who are engaged in clinical education research, and you have many of these one-on-one opportunities with your faculty members. It's really a nice, tight-knit community where you really get to know your faculty and your co-residents in these programs.
What makes HSDM special and unique is the learning environment. It's a smaller program. Everybody knows each other. There's a lot of multidisciplinary opportunity for learning. I chose PROS because I get to treat the most challenging patients. It's like a transformative part of it. And I think the standards for care and the standards for delivering prosthetics for our patients here is a much higher level.
It's a real honor to be a part of the clinical setting here at HSDM because our patients come from such diverse perspectives and backgrounds. One of the most incredible thing about orthodontics is that there's so many different perspectives and different ways to treat cases. I've been lucky to have the most amazing faculty and co-residents where I'm able to brainstorm and talk about different options, and it creates the most incredible learning environment.
I chose endodontics because, in my opinion, it is the most detail-oriented dental specialty. So in terms of patient management, you get a patient that walks in and they are in extreme pain, and right after the appointment, 2 hours later, they walk out and they're feeling a lot better. I find that very gratifying, and it is definitely the best part of what I'm doing here at Harvard. In terms of mentoring opportunity, it's been a very supportive environment. Everybody is willing to help you, whatever it is that you want to achieve.
I've always really been interested in craniofacial and cleft lip and palate cases. I have the opportunity to do my research in Boston Children's Hospital. Someone's interest in research can be fulfilled in so many different places around HSDM. We're surrounded by Boston Children's Hospital, the Forsyth Institute, the School of Public Health, and the medical school. And it's really incredible to be able to utilize all these resources to explore our passions.
My innovation is a dental tool that can be used in the clinic that will facilitate working with the special needs patients. There is no limit here. I'm still discovering, I'm still looking for more opportunities, and I'm still growing.
At Harvard, you have the opportunity, since it's a small community, you can reach out to any faculty, any professor, and they're all excited to work with you. You could do benchtop research or you could do clinical research. I'm doing clinical research, it's ultrasound research, and it's part of a randomized controlled trial. I did take one cross-registration course at the MIT School of Business at Sloan. You really get to expand your network outside of just Harvard. There's one of the big benefits to coming here.
It's really important in our program that we have a team environment and that we're all team players. There's many times in the clinic where one of us are behind and we always just help each other, and I think that's such a unique and important aspect.
You get to really know your classmates outside of a school environment too.
One of the most amazing things, even within my program and the residents in the program, is that they're from all over the world and they have so many different experiences and backgrounds that really adds to the value of the program and the school. Outside of the school, we also get together and we do things around Boston. Some of the things that really stand out about Boston is how historic Boston is. There's so many different communities in such a small city. Boston, for me, is the perfect size.
Boston's a large biotech hub. And, the opportunities that you get here really don't exist in other cities.
Boston's awesome. I love walking, and Boston's one of the most walkable cities.
You should come to HSDM if you want to elevate your standard of care and your execution of care.
You should come to HSDM if you want to push yourself out of your comfort zone and be the best clinician that you can possibly be.
If you feel like you are on the right path to becoming a specialist in your field, to become a leader in your field, I think that Harvard is definitely a great place to do that.
You think about our mission is really to foster a community of global leaders in education, clinical innovation, and research that integrates medicine and dentistry. So if you think about a program like HSDM's AGE programs and you want to make an impact, this is the place to come to and train.